Welcome to the Weekly Diabetes, Stuff You Should Know. I'm Marissa Town, Clinical Director for Children with Diabetes. And this week we're going to focus on promoting diversity in clinical trials. The health disparities among people of color in the United States have been thrust into the spotlight with the pandemic. Multiple studies have shown an increased infection rate and increased mortality rate for people of color compared to their Caucasian counterparts. One of the ways that our healthcare system is looking to help address health disparities is to promote diversity in clinical trials. The FDA officially put out a guidance on November 9th of 2020 to help promote and protect public health by increasing representation of minorities so that the people that are in the studies are representative of the broader population. They recommended fewer exclusion criteria so that people that are on multiple medications with multiple illnesses could still participate in the study. And again, this is more representative to the real world. The guidance also says to focus on getting real-world data and encouraging study designs that require less travel for participation. Having worked on clinical trials for closed-loop systems at Stanford myself, I can say that there were people that would drive hours for participation in the clinical trials, and the visits were sometimes long and frequent. It makes it really hard to be able to participate in clinical trials if you're having to drive for 3 hours just to get to that visit, and then the visit lasts multiple hours. It also required the study staff, including the doctors, to work evening and weekend hours to try to accommodate the participants. One of the benefits of the pandemic is that it shows the necessity for electronic visits as opposed to in-person. And this goes across healthcare systems and not just for clinical trials, also for visiting with your endocrinologist or your other healthcare providers. And it really creates more flexibility when you can visit electronically as opposed to having to drive in. But that limitation is having access to Wi-Fi, which most people, I think, in the United States have, but that's not applicable other places. And another part of the guidance was to encouraging having study providers and study coordinators that are diverse themselves and having the study completed in an area where people are more diverse. And this is a really important thing and something that needs to happen across the healthcare system, not just for clinical trials. And this is just one thing of many that need to be addressed to help reduce the inequities that are seen for people of color and just to improve outcomes for people with diabetes across the board. Thank you for your time. I hope we've given you some insight into things that are happening currently. You can also see our recorded webinar with Quisha Umemba on diversity in diabetes. She is a nurse, a diabetes educator, and founder of a new nonprofit organization, Diversity in Diabetes. You can find the link to this recorded webinar on CWD's website under Screenside Chats or on our YouTube channel, which is youtube.com/CWDiabetes. For more information about our upcoming conferences, Screenside Chats, meetups, and more, please see our new updated webpage, which is cwd.is/community. Stay healthy, take care. See you next week.